Hi, I'm Brian Ayers. I'm the CEO of Open Door Health Services. What you're about to see is a set number of frequently asked questions that we're finding a lot of people have when they're hesitant to get the COVID vaccine. These are community leaders and professional medical leaders, and we're hoping this is very helpful. Thank you.
Hi, my name is Ken Hudson. I am the Executive Director for the Whiteley Community Council. We have a panel here with us that we're going to have a good conversation around the COVID-19 sickness and the vaccines that are out. We'll discuss all three vaccines in some way, but we'll like you to be introduced to our panel.
I'm Dr. Beena Joseph. I am a pediatrician and I am located at the Open Door facility on White River Boulevard.
I'm Dr. John Woodall from Anderson, Indiana, and I'm in family practice and practicing at Open Door in Anderson.
And I'm Ashley Wilson. I'm the Director of Clinical Operations here at Open Door Health Services. My background is primarily in public health.
The first question is, what is an mRNA vaccine and how does it work?
The mRNA technology has been being developed over 3 decades, so it's like 30 years of research has gone into mRNA technology. So it's not something that's new.
Yeah.
Scientists have been working on this technology and they've been trying to use this for Ebola virus vaccines, flu virus, Zika virus, RSV virus. So these technologies are being developed, and thankfully they've found the Moderna and the Pfizer vaccines using this technology to be effective against coronavirus.
Dr. Joseph, what is the difference between the Moderna, Pfizer, and the J&J vaccines?
So the Moderna and the Pfizer vaccines are two doses of the vaccine need to be given, versus the Johnson & Johnson Janssen vaccine, and that's only 1 dose. There are 2 different technologies that are taking place for these 2 sets of vaccines. The Moderna and the Pfizer is the mRNA virus vaccine. The J&J vaccine is using a really harmless virus called adenovirus. It's a virus that people have gotten in childhood with common colds. So this is not an infectious virus. It's using that as a vector or a delivery system, like a delivery shuttle, into the cell and telling that cells, look, this is how you create the spike protein for the coronavirus. The cell will then see that, produce the spike protein, and then the body produces the antibody. When the person gets exposed to that virus, coronavirus, they'll say, oh, we have the spike protein, we know what it looks like, this is what it looks like, let's fight this. And that's how the adenovirus vector vaccine, Johnson & Johnson, works. So there are 2 different technologies for it. The Moderna and the Pfizer have to be frozen. The other one, Johnson & Johnson, is refrigerated. The Moderna vaccine usually is given at 1 dose, and then the second one is in 28 days, while the Pfizer vaccine is the first dose and then 21 days later. The Johnson & Johnson is just 1 dose.
Okay.
So those are the different sort of, the Johnson & Johnson vaccine using that technology with another virus as a vector has been researched for over 50 years. So this is not a new method of creating a virus vaccine.
Twice now, so far, we've heard that the statement, this is not a new, and it's something to pay attention to because this is new territory for us citizens and residents and normal folk. It's not new to the medical field. So this, in many cases, this is the first time we're hearing mRNA and things like that. So we feel as though it's brand new. So thank you for mentioning that. Should there be any fuss about picking which vaccine you choose?
Generally, the purpose is that we need to get as many people immune to this virus as possible. And so the 3 vaccines that are available now in the market are really effective at it.
If it's offered to you, take it.
Yes.
It's offered to you. Okay, Ashley, would you like to?
So speaking of efficacy, there is a slight variation, but overall, all vaccines are very similar in preventing severe illness and hospitalization. They did studies on all 3. In the Pfizer study, they used 40,000 participants and then found afterwards that it was 95% at preventing symptomatic COVID. Same thing with Moderna. They used 30,000 participants and found that after that study, and participants were aged 16 to 91 for the Moderna study, aged 18 to 95 for the Pfizer study. Both of those vaccines are the mRNA vaccine. They are very similar in efficacy. The Johnson & Johnson and Janssen vaccine is the single-dose vaccine. That is 65% effective at preventing COVID. However, out of the 40,000 participants in the study, they found that it was 100% effective at preventing serious illness, hospitalization, and death. But at this point, as far as what the studies are showing and what the reports are showing, the vaccines are all 3 very effective.
There's different levels of skepticism when it comes to taking the vaccine. So I would ask you, have you heard of or have you yourselves been asked to report positive numbers or given any type of incentive for agreeing with taking the vaccine or any type of positive information sharing concerning the vaccine?
We do not get paid for trying to promote vaccinations. We do not get paid through the federal government for providing vaccines. We do not. So the federal government is paying for all of the vaccine and the development of it. So there is no kickbacks from Pfizer or Moderna. We are just clinicians that are trying to take care of our patients and our families the best way possible with the evidence that we have. And so there is that integrity in that too that I think people should be able to trust.
Thank you. Okay, we'll go to our next question. Dr. Woodall, who should and who should not get the vaccine?
The way I look at it is everyone should get the vaccine except if the person or persons have anaphylactoid type reactions to medications. In other words, if they have allergy, severe allergy that require medication. Otherwise, the scientific evidence shows that everyone should be eligible to get that.
Our next question is for you again, sir. What is the vaccination process?
They inject the medicine in the upper part of the arm and then withdraw the needle. And after the injection, there is some discomfort at the injection site. Some people have other difficulty, but usually the soreness is at the site is something that can be counted on. So it's not unusual to have that.
Depending on which vaccine you get, you may be asked to schedule a second dose if it's one of the Moderna or Pfizer vaccines. So if you come in for your first dose, then you would expect to schedule your second dose at that appointment. Some of the side effects with the vaccine, as Dr. Woodall said, the most common one that's been reported is the injection site pain, sometimes a little bit of redness around that injection site. Some people have reported a little bit of tiredness, fatigue, body aches, just general not feeling well the next day. That's actually a great thing. That's a sign that your body's immune system is responding how it should to the vaccine, so that your body's learning how to fight the COVID virus. So those symptoms are usually reported 1 to 2 days we're seeing after someone gets the vaccine, and then they feel better.
Okay.
So.
You mentioned counting on the arm soreness when
Yes.
you get the vaccine.
Yes.
I myself has had the first shot,
Mhm.
and the only way I could remember actually having the shot was that I would reach over and scratch my arm because it itched
Or
every
feel
now
the
and then.
Band-Aid.
Yeah, it really didn't faze me at all, other than a little itch. And one of our volunteers reported the same thing to me just this morning. He had his second shot, and he said it was just a little itch in the arm over a couple of days, and that was it. Comparing the first shot to the second shot, where most have said, my second shot, I felt a little worse for a couple of days. Is there any scientific explanation for that? Like, for instance, I guess what I'm asking is there a larger dose of the medicine in the second
No.
shot or something like that? Or what's happening in the body?
I think the body has started to reacting, and so it's building now, and it's working at that. So I think that's probably the reason you can get the chills and the achiness and that kind of discomfort with it, as opposed to at the first injection.
With an immune response, when your body is initially exposed, sometimes your immune response is slightly lessened because it's learning how to respond. But then the next time it's exposed, it's built a little bit of an army, and so the next time it's exposed, it has a stronger response. And so that would be why sometimes people are having the more reactions after the second vaccine.
That's a good way of explaining that. Thank you. It's kind of, like you said, it's learning. It's a learning process.
Yes.
You're training yourself.
Yep.
And then the second time around, you're ready for war, in a sense.
Uh-huh.
That's a good way of putting it. If I've gotten a vaccine, can I stop wearing my face mask?
I am so glad you asked.
Everybody's question.
I'm looking forward to taking this off. You know that, right?
That's right.
Very much so.
That's right. So what the CDC is recommending is that if you are with other people who have been vaccinated and you yourself are vaccinated, and everyone everyone you're going to be around is vaccinated, then you can be without a mask in that small group setting. Or if you have been vaccinated and maybe there's one other person who has been unvaccinated, they are saying it's okay to take off your mask. However, in large group settings, in public, at work or church or wherever, it is still recommended to wear your mask. You can still get the COVID virus, but many times after you've been vaccinated, you don't even know you have it. So you could still spread the COVID virus to others who may be at higher risk or may have not been vaccinated. And you may have the protection of the vaccine, so your symptoms won't be severe. You likely will not be hospitalized. You may, like I said, may not even realize you have it, but can still spread it to others. So that's why it's really important to still wear masks, still try to physically distance in larger group settings and that sort of thing.
So you're saying if I'm fully vaccinated or even halfway there, I could still have the virus in my system and share that virus with my loved ones who have not been vaccinated yet.
That's correct. And another great reason of why it's so important to get vaccinated, so that everybody has that layer of protection.
And this is also a good discussion about herd immunity
Yes.
too, and you've heard herd immunity being thrown out in the news and things like that. And the herd immunity is an indirect way of protecting a whole population. And the vaccine rate in that population has to be really very high for you to eradicate the virus. So our goal is always to eradicate coronavirus like we eradicated smallpox.
Is there a magic number for herd immunity? Where do we get to
each
that?
of these illnesses, like even polio or smallpox, or they have different sort of herd immunities. So in smallpox, for example, you need 80 to 90% of the population to be immune for you not to spread smallpox and eradicate the virus. So it depends a lot on the virus as well, how infectious the virus is and how contagious it is and how it's spread, how easily spread it is. So there is not a good number for coronavirus, but 80s is the best. The minimum is usually in the 80% range for people need to be vaccinated, because there are always people that can't get the vaccine. The others who are vaccinated protects those vulnerable groups. So that's why it's not just protecting yourself, but it's also protecting those that cannot get the vaccine.
The vaccines, Dr. Woodall, were developed pretty quickly. That lend itself to a lot of skepticism. Can you tell us anything about the safety because of how fast it was produced? Is it safe?
The vaccine is safe, and it should be pointed out that how fast it is talking about how fast the people were paid or were promised that they would get paid for making the vaccine. It didn't have anything to do with how fast the vaccine, because they had already put it in 20, 30 years of time put in developing it. So it was developed and could be produced rapidly because of that.
Because the federal government pitched in and put
you
in
spoke
most of
about
money.
that earlier
Yeah. And so
with
usually
the-
it's very difficult to get money from private companies to
Yes.
sponsor medications and vaccines on a regular basis. But during a global pandemic, the federal government gave the money to develop this quickly. So that really tells you, the process was the same. It was just the funding was quicker
The fund is
than
there.
usually. Sometimes funding takes years and years for
Years.
them to develop any type of medication. They need the money for it, and federal government doesn't usually support those things. So
So did our government share information with other governments to get the vaccine produced quicker? Was there like a sharing thing going on here, information sharing?
So federal agencies, state agencies, international agencies have been sort of discussing, WHO, CDC, FDA, discussing about what are the options for this. So there were almost 19 vaccines that were in the running in the US, and it came down to Moderna and Pfizer having the better data in their phase 1 trial. So
see.
there's different phases of vaccine development. Phase 1 is the initial, and then it goes through phase 2 and phase 3, expanding on the numbers of people getting into the study. So whoever was the quickest and the best was what they were looking at. So in Germany and in a Syrian researcher and scientists who've been doing a lot of work in decades came in and put in more of their effort to develop these two. So there were multiple vaccines in the running.
I see. That's something that's not talked about very
Yeah.
much. Thank you for sharing that. I had no idea there was 19, and it was narrowed down to the best of the best.
Best of the best, yeah.
Okay. Dr. Joseph, how can I feel confident getting the vaccine when I'm not sure and I don't know what the long-term side effects is going to be?
Sure. Long-term side effects, everything has side effects. There's not one medicine that you take or a vaccine that you take that is 100% effective and 100% safe. Even Tylenol has side effects, is what I tell my parents of my kids. So with that in mind, we try to choose medications or vaccines that has the most benefit with the least amount of risk. And that's how we select how we treat. As a pediatrician, I'm very careful with medications that we give our kids. And with that, we really need to make sure that we know what the benefit is and that the child won't suffer from it and get some benefit, and that the benefit outweighs the risk.
Would the vaccine give someone the COVID illness?
Sure. So it's not a live virus vaccine, and that's important to understand. only if it was a live. So chickenpox vaccine and MMR are live virus vaccines. So there's a component of live virus in there. So the COVID vaccine has no live virus whatsoever. So it will not give you COVID.
It will not give you
It
COVID.
will not give you COVID.
Should children take this vaccine?
Moderna is going out and started to recruit at least 7,000 kids from ages 6 months to 12 years to start studying this. And this is really important for our children. The Pfizer vaccine is approved for 16 and above, so they did have some numbers for late teens. But these are the younger kids, the age group they're now looking at is 6 months to 12 years. They've just started it. Usually phase 1 is just a small number of people they'll test in healthy kids to see if there's any major side effects. Then they'll go on and expand to that. So the thing with children is that if we have all the adults vaccinated, it pushes the virus to look for a new host. The virus needs to survive. And so it may make children get more sick from COVID because the adults are okay now, they've been vaccinated, and our children may be at risk. So we need to make sure that our children also get vaccinated. So it's really important that they do the studies and research for it.
I've heard a lot of people say I'm waiting because I don't necessarily trust the vaccine yet, so I'm going to wait and see. I don't know necessarily what they're waiting to see, but that's usually what I hear. Is that a smart move? What would you think?
That's probably not a smart move in light of the way the death pattern has shown us. Just even looking at the number of deaths of people who have not trusted that or have not had it, and they pass away. What we need to do is continue pushing the injections, making sure that people get the vaccine so that they're protected. They need that because there's actually nothing else left for us to do. And each individual has a role to play. You're protecting me, I'm protecting you. That's going to be the American way for a while.
So can you tell me why has this sickness affected African Americans so drastically?
Probably some of the other health factors, diabetes, hypertension, obesity, those factors are also high. So we find a lot of other factors in the Black community that contribute to illness. And those illnesses make the population vulnerable to what's going on.
And historically speaking, there's a lot of mistrust, and it's understandable mistrust in vaccines and in healthcare and in providers, and having those kind of questions that you've brought up. So that could also make vaccine hesitancy an issue, and following those kind of recommendations. So hopefully education and that you can trust this vaccine, and looking at data, and it's just not anecdotal, but actual numbers, and numbers don't lie usually. So it's trying to trust that process as well will help the African American and any population, of course.
Ashley, what if I don't get the vaccine? What risk do I have?
That's a great question. So I think the main risk would be that you could contract COVID and develop serious illness, severe long-term effects. There's more and more reports on long-term effects of COVID, even after you've recovered from the initial acute illness. Things like brain fog, cardiac issues, kidney issues, decreased lung function, long-term, possibly forever effects that you could, have as a result of COVID. And they are not finding any of these issues with the vaccine. So the risk of getting COVID is much higher than any risks or any side effects of the COVID vaccine.
Let's see, and this question is our last one, and it's for everyone. Dr. Woodall, you mentioned getting a vaccination shot. Is anyone else on the panel vaccinated fully?
Yes, I got the
Yes.
Pfizer vaccine.
You got the Pfizer vaccine? Which one did you get?
I got the Pfizer vaccine. I was
Pfizer's the-
eligible in the first wave with the
Right.
healthcare workers,
Okay.
so that was the first
Moderna.
one.
Moderna. Okay, so what was your experiences in your first and second shots?
So the first one, I had a little bit of arm soreness. I couldn't sleep that well that night. Took some Tylenol, and it went away. So the first vaccine was pretty good. My husband had a little bit of a headache the next day, but that was about it. The second dose, I had a little bit of armpit pain, and that's usually some of the lymph nodes reacting to this vaccine. And it was not anything major. A little Tylenol helped, and it went away within a day or two. But thankfully, nothing else.
Okay, and yours, sir?
I had no problems at all. That's
That's good. That's good. Ashley?
Similar to what Dr. Joseph said, I had a more severe, I just felt worse after my first injection, but I actually had COVID and was hospitalized months ago, and thankfully have recovered. It's still having some of the long-term things, but so all to say mine was slightly different, but same side effects, just the achiness, the arm soreness, that sort of thing.
And that's an important point, that if you've had COVID in the past, they recommend that you do get vaccinated.
Right. Yes, indeed.
And that's important to do. And
How long after is it? I've heard 90 days. Is
So
that
90
accurate?
days if you've gotten monoclonal antibodies or any type of medications, IV, and when you're in the hospital. So they usually say around 90 days the immunity is waning or going down, and then that would be a good time for you to get. So immunity is not lifelong, as so far as we know, and that usually around 90 days it's dipping down. So if you've had COVID, you can definitely get the vaccine, and you should.
And you could get COVID again.
Yes, with a variant or
Absolutely.
again.
Thank you for your
Thank you.
time so much. Much appreciate your time and your expertise and having this conversation today. I really appreciate it.
Thank you.
Thank you so much.
Thank you.